Hello, I'm Susmitha. And I'm Lindsay. And today we are going to talk about health promotion concerning hearing and other sensory communication disorders. The goal of Healthy People 2020 regarding hearing and sensory communication disorders is to reduce the prevalence and severity of disorders of hearing and balance, smell and taste, and voice, speech, and language. Hearing and sensory disorders are a lot more common than you might think. 1 in 6 Americans experience a sensory communication or hearing disorder in their lifetime. This means that as a nurse, you will most likely provide care to someone with a hearing or sensory disorder, and you are going to want to know how to help in these situations. Our learning outcomes for today's topics include 1. How are individuals affected by hearing and sensory communication disorders? And number 2, as a registered nurse, how can we promote good auditory health for individuals across the lifespan? The Center for Disease Control and Prevention states that hearing loss occurs when any part of the ear is not working in the usual way. These malfunctions in the ear can be in the outer, middle, or inner ear and the acoustic nerve. Risk factors for hearing loss include our genetics, a viral or bacterial infection, sensitivity to medication, exposure to loud environments and noises, and injury to the ear, and aging over time. Hearing or sensory communication disorders that individuals experience can contribute to a decline in both mental and physical well-being. Without treatment, an individual may experience difficulty in achieving success in the work or school environment and may fall into social isolation as a result of not being able to communicate effectively. These factors can affect the individual's self-concept and lead to other health-related issues over a period of time. So, what can we do to prevent hearing loss and promote healthy hearing? As a registered nurse, it is essential to promote hearing education and screen individuals across their lifespan. Hearing and communication prevention should be implemented at an early age. A nurse should begin with early promotion by screening for hearing loss in infants. It is recommended that infants have their hearing tested no later than 1 month. Tests that are commonly used on infants at this age include auditory brainstem response and autoacoustic emissions test. If a hearing loss is detected in an infant, it is important that interventions are taken immediately to decrease adverse outcomes and to potentially correct the hearing. If this does not occur, the child could be susceptible to other disabilities, such as changes in speech due to the inability to hear, as well as limitations to success in academic and work environments. For children and adults, hearing tests should happen at least every 5 years. If hearing loss is detected, there are interventions that can be taken to prevent further hearing loss. One intervention would be maintaining auditory health through audiological evaluation. One big way to prevent hearing loss is by wearing protective ear devices such as earplugs when you're in a loud environment. For patients with a hearing loss, an audiologist may recommend that they get a hearing aid, cochlear implant, or assistive hearing device, depending on the severity of their loss. Let's talk about some of these options. A hearing aid is an electronic device that brings amplified sounds to the ears. It contains a microphone, amplifier, and receiver. There are different types of hearing aids the patient can get depending on the severity of their loss. Cochlear implants are medical devices that bypass damaged structure in the inner ear and directly stimulate the auditory nerve. Cochlear implants are most commonly used for patients who are deaf or have an extreme hearing loss. Assisted devices might also be used, such as text telephones and text-to-speech converters, which help with the communication that is not done in person and over phone or technology. Common factors that might get in the way of a hearing loss include exposure to loud noises and environment and a buildup of earwax in the ear. As a nurse, we might run into some problems where patients might not want to follow our health promotion, as most individuals who could benefit from hearing aids choose not to wear one. It is important that we know these factors that influence their decision, such as the high cost of the hearing device or the negative stigma that might come with getting a hearing aid. This is where we can help communicate and help them rethink these different problems. Now we are going to show you a scenario that illustrates some of the things we went over, as well as how to promote health in a positive way. So my name is Lindsay and I'm going to be your nurse today. It says here on your chart that you are coming in because you feel like you haven't been able to hear recently. Can you tell me a little more about that?
Yeah, so recently I've just been having a hard time with like conversations, and I have to keep blasting my music and the volume on the TV. So my mom wanted me to get my hearing checked out.
Okay. Do you know when your last hearing exam was by any chance?
Not really, maybe like 5 or 6 years ago when I was in like 8th grade.
Okay, I'd like to do a quick hearing test on you real quickly just to see where your hearing at is right now and if there's been any big changes that we need to accommodate to.
Okay.
So, Sweet, that I'm seeing from your test results that you're experiencing a severe hearing loss in your left ear. Can you tell me about any experience of loss you may have or any effects it's having on your life?
Well, it mainly just affects my conversations with others. Like, I'll hear part of what they're saying, but not all of it. It can make it hard in social settings sometimes, so sometimes I just pretend that I understand what people are saying and go like, yeah. And then it just makes it embarrassing too sometimes because like I don't like being that person who's like, can you repeat that for the 100th time again? And also like just with school, it's been a little harder because I can't always hear what the teacher's saying or my friends. So I think my grades are suffering a little bit too.
Seems like your hearing loss is taking a big effect in your social life and the way that you get through things every day. And we want to see you be healthy and happy and be able to feel comfortable in those settings and be successful in school and work. Have you ever thought of an assistive hearing device?
Not really. Anyways, aren't those for older adults and won't I look weird with one?
I understand where you're coming from, but you're not alone in thinking this. Hearing loss is a really big thing and it's an evolving problem still. Over time, your hearing loss could become worse if we don't try to correct it now. So I'd like to give you some options if you're okay with that.
Okay.
Okay, so here's a local audiologist number and he could help you through further screening and figure out if you do need an assistive device and which type of device to give you. And then also there's some tips on ways that you can keep promotion for good hearing, such as when you're in a loud environment, you can wear earplugs. Or if you're listening to music, you can make sure to turn it down to a nice level so you're not blasting music into your ears, or even if you're watching TV. And then for cleaning, don't use Q-tips or bobby pins. Try to use the liquid solution that you can buy at the store. Are there any other questions I can help you with today?
Nope, that's all.
Thank you. Scenario, hearing loss can be a pretty big deal. Hearing loss affects over 48 million individuals in the United States alone and is still an evolving problem. The scenario illustrated how a registered nurse should care for patients who may experience hearing or sensory communication disorders.
While assessing the patient, the nurse faced her while gathering information. During this time, the nurse looked for any hearing loss illustrated through slow response time or miscommunications in answering the questions. Following the assessment, the nurse then implemented a test to detect for any changes in hearing.
At this time, appropriate hearing tests that the nurse could perform include the whispered hearing test, Weber or Rhine test, or others. After receiving a positive test for potential hearing loss, the nurse educated the patient on hearing loss, assistive hearing devices, and provided a referral to what the patient could do next to prevent further loss.
For our learning outcomes, we hope you take these 2 things away with you.
1. Hearing loss and sensory disorders affect patients in various ways, as hearing loss plays a negative role in effective daily communication, which can lead to social isolation, decreased success in the workplace, and lead to further mental and physical health changes over time.
2. As nurses, health promotion and prevention is essential for patients to know and understand. Early detection of hearing loss can make significant differences in preventing, catching, and treating hearing loss at an earlier age. The nurse can accomplish this through educating parents on hearing tests for infants. For adults, the nurse can promote getting a hearing test at least every 5 years. The nurse can also promote healthy hearing by educating patients on healthy ways to clean the ears and by wearing protective hearing devices such as earplugs when they are in noisy environments.
For more information, you can go to Healthy Partners 2020. Thanks for watching.